Well, I treat a lot of people with chronic plaque psoriasis in my dermatology practice every day. I'm here on behalf of Bristol Myers Squibb and the Clear Understanding campaign to talk about psoriasis and a potentially a new therapy for patients who have plaque psoriasis. Plaque psoriasis is a chronic immune skin condition, autoimmune skin condition. It affects about 7.5 million Americans, and it's about 2.5 million Americans who have what's called moderate to severe chronic plaque psoriasis. It shows up on the body as well-defined red or pink plaques with scale on top. Darker skinned individuals, it might be a brownish or purplish plaque with scale on top. Invariably, patients with psoriasis complain of itch and maybe pain and soreness associated with the plaques. And it can be 1% of the body, just a patch in the scalp or in the elbow, or it can be 80% of the body. And that level of severity is one of the aspects of plaque psoriasis that allows us as dermatologists to determine what's the appropriate therapy for patients who have the condition.
Now, when should patients talk to their doctor about what treatment options may be most appropriate for the disease?
I like to keep it simple. If you're not happy with the psoriasis, how well it's controlled, you have symptoms, it makes you embarrassed, you wake up every morning and you're reminded you have it, either by looking in the mirror or how it feels on your body, you should visit your dermatologist, learn of the treatment options, and tell him or her you want to see better control of your condition. Remember, we don't cure psoriasis, we treat it, we manage it, much like a person with high blood pressure has to manage their condition through either medicine or dietary or lifestyle interventions.
Now, doctor, if you would tell us about the latest oral treatment options for moderate to severe plaque psoriasis.
Right. So TIC2 or deucravacitinib is an oral once daily pill approved for patients who are 18 years of age and older with moderate to severe plaque psoriasis. It is a medication that's been shown in clinical trials to induce clear or almost clear skin in approximately 50% of patients versus only 9% of the placebo group. Now, also important is, so TIC2 can be associated with certain side effects, and therefore you should discuss not only the potential benefits, but also those potential side effects when you visit your dermatologist and talk about TIC2.
I'm Nitika, and also here on behalf of Bristol Myers Squibb for the Clear Understanding campaign. And oh my gosh, I got psoriasis, I've had it for as long as I can remember now. I've had it for many decades. When I was younger, I was diagnosed, and it started as a small patch on my arm and moved pretty quickly to covering most of my body from the tip of my foot to the tip of my head. And a lot of people don't realize psoriasis isn't just a skin condition. It's something that can cause a lot of, insecurities. It can be challenging in social situations. It really impacted my ability to feel free and carefree as a kid. I used to love soccer growing up, and I had to quit soccer because I was so physically uncomfortable. And it's been great to be a part of this Clear Understanding campaign because you can actually visit clear-understanding.com and see other stories of people just like me who are living with moderate to severe plaque psoriasis and see how they can feel empowered in their life and how they go throughout their life with that sense of empowerment, breaking those stigmas. I know when I was growing up, I did not think that there were other people out there living with chronic illnesses and psoriasis in particular. And it's been really comforting to see that I'm not alone.
Now, tell us more about the Clear Understanding campaign and what motivated you to become involved.
Yeah, so just as I mentioned, I'm so excited to be a part of a Clear Understanding campaign with Bristol Myers Squibb because I spent so much of my time feeling so alone while living with moderate to severe plaque psoriasis. So I hope that people will visit clear-understanding.com to learn more.